Hello again, it's Tracy. Today we're picking up where we left off in this two-part conversation. If you haven't heard part one yet, I really recommend starting there. And if you're returning, welcome back. I'm so glad you came. I don't love talking about death. A few months ago, Oren is my husband for those that don't know, um, we did a two-parter on and someone led us through my advance directive. And there were times that I was really emotional. I don't like talking about death. I mean, yes, even though I'm a death doula, I don't like talking. Wait a minute. I don't like talking about my death. Okay, or my husband's death. Okay, death is okay, but not me or my husband's death. And it was a very emotional conversation. So even when I talk about or even think about my husband dying or me dying, I get really emotional. And I deal with death all the time. So people who don't, I don't even have to imagine it. I see it every day. So it's not something that is a comfortable conversation, but having those conversations is such a benefit because now I know, you know, if you have them, what your quality of life, what you want your quality of life to be. You know what type of care you want. And you could have those honest conversations and you could talk about things like hospice, which I'm a huge advocate of. I am uh, every day. I've really never had or rarely have I had a negative experience with hospice. They are such a benefit. And I think we do ourselves such a disservice when we don't bring hospice in sooner. Many clients wait until the last minute to go into hospice. And the way that you live, they just increase your quality of life. They make you more comfortable. They make your life better. So I'm in total agreement with you we do ourselves a disservice, and how different would our quality of care be? And one thing I found interesting that you were talking about is with pediatric hospice, it isn't that 6-month time frame that they uh, that because usually when an adult goes in it, at that point you are not looking at life sustaining treatment anymore. You're
Yeah, no,
not.
that's a great point. And I'm sorry I touched on that, but I never expanded. So, again, this could be very specific to our hospice, but they actually have almost like two arms of their hospice. One is called transition program, and one is called hospice. And so the transition is where you can be enrolled if you have a life limiting condition that, can't have a quote unquote cure. And then the other arm of that is when we're looking at months or less.
Mm.
And it's really semantics for insurance in the sense of how much more frequent visits we can have from providers, but you don't get kicked out if you are living longer than 6 months. So, we're currently in the transitions program. And the other thing, and I don't know if this is different from adult or pediatric, is because Soraya's condition, well, one was undiagnosed, two is now diagnosed, but still she's an N of one. There's no way to predict that time span. And so we are looking at other factors to make a change of paperwork. We know that she's declining. And so we know in the coming months, she will switch over from this transition to hospice. Again, I'm not sure how other pediatric programs work, but I will say the majority of them do not have a 6 month or less prognosis, and it does not eliminate your ability to get care, meaning that we still do her follow up appointments, we still do care. Now, that being said, every test, every x ray, every doctor's appointment, we actually think about, and we think about what does this do for the overall picture? And so I think that having hospice involves creates a template and an algorithm of how we make our decisions. And so
Mm.
one example of that that I think is helpful to realize, she already has a G tube. So that is not necessarily a discussion of like, oh, do we get her a G tube or not? She's had one since she was 6 months old. However, one of the things that she does is she eats for enjoyment. And as her
Mm.
muscles are getting more tired and it is harder for her to chew and swallow, we have modified her diet to a softer diet. Now she's choking and gagging. So it's very understandable that, her pulmonologist had said, let's get a swallow study. We want to see if she's aspirating because then this is going to put her at risk for pneumonia and, that could be a really big problem for her. And in talking to the hospice team, said, okay, well, we know that she's progressing. What will it change if we know that she's aspirating? Will you do a liquid diet? Will you do a thickened diet? Will you do whatever diet that she needs? Or do you want her to like eat what she wants and not have to worry about it, knowing that there's a risk? And so we brought that up to Soraya, and she said, I just want to eat what I want. I don't want to, and honestly, I don't even want to taste the barium. I know they can hide the flavor, but she said it's actually a lot of work for us to go down to the hospital, me sit in that x-ray room, have somebody feed me different things and take pictures. She's like, that sounds exhausting. No, thank you. And so that's the difference where because we're in hospice, we feel some empowerment, structure, guidance on having these decisions to make us feel like we're making the best decision for Soraya. And we've got the support of a team that helps us with that. So it's interesting because I think there's so many myths out there that if you're in hospice, you're giving up, and we're not giving up on anything. We're we're giving towards her having
Mm.
a full and happy quality of life. Are there things that we can do to prolong her life? Sure. And that was, a conversation with a trach. But again, with the help of hospice, we talked about that doesn't actually change her underlying medical condition. There are other things happening in her body systems that are going to be life limiting. And there's risks. And what does it look like to have a trach? What will that look like to have 24-hour care needed? What will it look like to have her be hospitalized to get scopes every, several months? And how does that impact the rest of the family? And so those are conversations that we would have not been able to have or even think about without the help of hospice.
That's one of the reasons why I'm such a big advocate of hospice, because not only pediatric, for pediatric hospice, but for adult hospice also, you get this this team. Hospice isn't a place. I always say it's not a place, it is a team. And it and they will provide you with what you need, as far as uh, that support of really understanding and have those conversations about quality of life. And many hospice homes and many hospices have, the massage, as you said, and all of them have social workers and chaplains and doctors and nurses, and all of these people are there to help you and your loved one have the best quality of life. And not only your loved one who's going through this, but you. So that support that you have, it, it it goes beyond what regular medical doctors can do. Not that they can't do it, but have time for.
Right. And I think that you mentioned like hospice is not a place, but then I do think it's good to point out that sometimes it is. And I think that's also a myth where, when I tell people she's in hospice, they actually think that she is like in a home, like not living at home. And so I think that's also just good to point out that hospice can look different in different areas, in different places. And I actually recently even knew that there were pediatric hospice homes. And so again, I wish I wasn't learning about it as I go, but I will take this journey and spread the knowledge so it's easier for people to know that these resources are there. And again, where I imagine one thing, it can be totally different. So thank you for even mentioning a place, because it can be, or it can just be a team that comes to you.
Yeah, yeah. Now I know that we've spoken about grief, and specifically anticipatory grief. Now, for someone who's never heard of anticipatory grief. How would you explain what it is and what it feels like, just from your perspective?
Yes, and I will say that it took me a bit of time to find that word of anticipatory grief and truly understand what it is, and I didn't actually know that it was a term. What I did know is once we entered palliative care and hospice, and once we all as a family talked about death, talked about where we are as a family and what will be happening as Soraya declines, I have felt myself being in almost like a parallel life where I know things are going to medically get worse for Soraya. And I have a job. I have two other children that need to go to swim practice, go to dance practice. I still need to be able to make small talk with people that I see when I'm out and about. And while all this is happening, I am so sad about grieving the future that I'm not going to have. So, like, all of these things are happening at once. And I realize that there is the grief that happens with each loss of things that Soraya used to be able to do, but also things like, my oldest being like, will Soraya be at my high school graduation? And will she be at my wedding? Will she? And I'm grieving all of these things, and they haven't happened yet. But it's almost like this impending sense of doom. And I don't mean to bring death to be doom, but doom to be the loss of the memories that I thought we would be making. And it is the anticipation, right? So it's almost like when you know you're going to have a procedure or a vaccine and you're like, I'm nervous about needles and blood work. It's the anticipation that you get nervous about. But once it happens, maybe it won't be as bad. I don't know. And I don't know if I can equate that to death because I haven't experienced actual her loss. But I will say the anticipation has been really tough. And so in describing that, that is the closest term that I could find to really explain how I'm feeling and what this is like. It is the grief of what's to come. And it's like we all know that it's happening. We all know that it's coming. And we're grieving and we're living. And it's all really hard.
How do you come to, you might not even have an answer for this, but how do you come together as a family to go through that, especially with two other kids?
I think that one is me realizing that we all, and I know that you know this from your type of work, but I don't think I realized it until I was in it, is that we all grieve differently. And sure, like that is like a great idea to just say out loud, like, oh yeah, we grieve differently. I think it feels very challenging when you're in a house with four other people that are actively grieving what's already been lost and grieving what's to come, or that anticipatory grief, and realizing that we're all doing it differently. And so, what does it mean to come together? And I think for us, what it means to come together is acknowledging that we're all different. And that has been really challenging. I think it took a lot of, you know, like trials to kind of see that, for example, my husband is a planner. It helps his anxiety to talk about, like, what will Soraya's funeral look like? What will we do with her bedroom after she passes away? For me, that causes a lot of anxiety, and especially if it's right before bedtime. I can't do that. Like, I just can't even wrap my mind around it. So it took us having discussions with our, therapists, and I will really put a plug. I won't even say a plug, it's a necessity. We all have a therapist, and that is a must. So, as soon as Soraya started in palliative care and hospice, we talked as a family that we all need a therapist. They all need to be different, but we each have our own person so we can deal with our grief in the way that we deal with it, knowing that we're not actually dealing with it. It's collective, but it's not. Like we all know it, but we all are dealing with it differently. And so, I talk with my therapist, like, I can't do that right before bed. And I was able to express that to him. Like, can you identify a person that you can have these conversations with so you get what you need? But I actually can't be that person for you because that is really hard for me. The other part is with the other two kids, they actually want very different things. So my youngest doesn't like talking about death, doesn't like talking about timelines. We still tell her when things are changing in the house, and that helps her anxiety. And when it comes to hospice visits, what we do is she actually sits in her room with a phone and she texts the questions that she wants answered, but she's not there for the whole meeting because she doesn't necessarily want to hear the answers of others' questions. So that's a way she can filter the information to what she needs to know. But there are certain knowns that we don't let her deny. So, as much as she doesn't like talking about it, there are certain things as we get new equipment or new people coming into the home or new medications, it's a must know because she's a member of our household and it impacts everybody. We want her to know the side effects. We want to know why she's irritable. We want her to know, why we're checking an end tidal CO2 and what that means. I want her to understand. Doesn't mean that she has to feel it all right now, but my job, at least how I look at it, is being transparent. I never want her to look back and say, my mom was guarding me. It's not like I'm throwing her into it, but I think that we have to meet your kids where they're at and where they're at developmentally. And I think that's also a challenge. We're not talking about five adults. We've got my husband and I, and then we've got three kids, and one that's actually experiencing all the symptoms themselves. My oldest likes to talk about it. She wants to know everything. She wants every detail. She wants to be a part of every appointment. And Soraya herself, if she had her way, she would talk about death all day. She's so curious. It's matter of fact, but that's really hard for the other two. Even though the oldest likes to talk about death, she doesn't want to actually talk about what Soraya will see when she crosses over. Sometimes she does, but sometimes it's like, Mom, it's too much. I need a break from it. And so that has been really challenging to kind of honor what each child needs. But many times we are dividing and conquering and separating space for each one. And let me tell you, they each need their space. I think that's important. I haven't been taught how to hold space. And I think that's also something to just put out there that, as a physician, we should know how to do that. But, medical education has been working the way that it has. To change curriculum, to change that is very tough. But, kind of trial by fire, I have been learning that each person in my house, I have to hold space. And that doesn't mean that I can fix it, doesn't mean I can change it, but I can just meet them where they're at. And there's no fixing it. And so that has been challenging. The one thing I always try to bring in is we have each other, whatever that looks like. Some person feels like talking, some we have to respect that. And so each of us identify, when it comes before a meeting, who's participating, who wants to know information, who do we not share information with out of respect for what they want, and we respect those boundaries.
Mm. And I love how Soraya is so open about, like, she's not avoiding that. She's like, this is what I'm going to go through. I want to know as much as I want to build my beliefs, and I want to know as much as possible.
Everything. I mean,
Yeah.
I want to also go to this myth of, children can't handle knowing that they're dying. I will say that I feel like they already know. I think it really gives them the power of speech is really important, and the power to articulate what they're feeling, I think, is invaluable. Putting words to her fears and acknowledging they exist as opposed to pretending like it doesn't, I think helps her quality of life. I I just think that it's really helpful. So I'm just putting that out there because I know that even, I have people within my own family that, feel like we're doing it wrong. And it's not that there's a right or a wrong, but it's like, oh my gosh, how can you let your daughter be depressed or sad about the fact that she's dying? And it's like, we have to give kids some credit. She knows her body. And whether you're a kid or an adult, just like you said, you know your body best and you know what you need. And she's questioning, why are my hands shaking now? Why am I getting weaker? Why was I made this way? What is my purpose? How can I be my
Mm.
best self in the time that I have left? It's literally what an adult would think, but she's a kid. So I feel like all of those thoughts and feelings are valid. There's nothing that has come out of her mouth that has been, I don't know, harmful to anybody. It's been helpful to know and for her to feel like she can process and share. And just like an adult, I would imagine she worries about worrying us. Like, I don't want to burden you with my thoughts and my feelings.
Mm.
And I have to say, like, as your parent, I'm here to hold that for you. Like, you're not alone. And I think that's what any adult would want to hear. Nobody wants to feel alone. And I think that is a very unifying theme in this world of death and dying is isolation. If you feel stifled by the conversation, you're going to add to that feeling of loneliness. It's going to really impact that quality of life.
I know last time we spoke, we talked about grief, but we also talked about joy and how both could exist together. Can you talk about that just for a moment or two?
Yes, I think with that line of feeling grief and joy also, I make a point to say that I have never had this all figured out and I'm figuring it out as I go because I think that's important. I think again, many times people see the titles of parent physician. Oh, you already knew what to do. What do people do that don't have a guidebook? Okay, I have no guidebook. I'm figuring it out. I will say that there was a turning point for us with grief and joy, and I think there's one where I am so trying to like fix Soraya, and then I'm at acceptance of who we're going to be with for a long period of time as far as being medically complex. And then there is, oh my gosh, she's dying sooner than anyone could expect, whatever that means. I think when you're in that space, and even being in that space, I couldn't find joy. I actually
Right.
was trying to figure out how to not find joy, but how to survive. And I was in survival mode, like I think many families would be. And it wasn't until I was, I had forced joy, and that was with Make a Wish. And so while many people might think of Make a Wish of like, oh, they do trips, okay, they do trips or something big for a kid illness or a life limiting condition, and it's a one and done. I will say that that was the complete mind shift for our entire family. It was not expected to be as such, but Soraya picked going to Hawaii. And while that seems like, okay, how can a trip to Hawaii change your whole mind shift? I think what that did is it was the first time we had traveled with her ventilator, her medical equipment, her G tube supplies. We had never flown that far. And we also got so tripped up on logistics as far as like wheelchair, beach wheelchair. We can't do any activities. We're going to just be sitting there. Like, why would we spend money to go to Hawaii? Like, we would have stopped ourselves if somebody said, here's even money to go on a trip. You guys go, you plan it. I don't think I could. I would have been so stressed out trying to figure out the logistics that I would say, we can't. She's too medically complex. I can't do it. But having them do all the logistics and showing what was possible and having our whole family be a part of it was the first. We didn't see Soraya as a patient, that we all felt joy. We felt
Mm.
relaxed. The beach wheelchair was there. They somehow got her on a surfboard. What? Like, never in my wildest dreams of somebody like, oh, Soraya wants to go surfing, and be like, yeah, nice dream. That's not happening. And so it was on that trip that all of us were like, this isn't even about Soraya's wish. Like, this is a wish for us. You guys, she is dying. How can we do more of this stuff? How can we just like make it happen? Even if we're the only ones that have ever surfed in this way or the only ones that do X, Y, and Z, how can we just make it happen? And that is when we decided to have this family motto of suck the joy out of life. It's a very like descriptive like word, but it's also very active. Like, you have to actively go do it. Like, you can't like sit and wait for a joyful moment. You have to go and seek it. And so it was that trip that totally changed our mind shift on, okay, let's all make bucket lists. What's feasible with finances? And let's see if we can do it for all of us, because really we all deserve joy. And how do we let go of guilt? Like, guilt doesn't serve us. We can have fun and know that she's dying. It doesn't, it's okay. We're sad about that and we can have fun. And so we really started on this whole path of, it could be like making s'mores by a fireplace. It could be touching our toes to the ocean. It could be going to a concert. It could be like nothing is off limits, and we have to like all decide as a family on who's up next for kind of like a bucket list fill. And I will say It's modifications. Like now that Soraya is changing, we are now looking for maybe more what we call glimmers of joy. So they may not be these big, shopping events or trips, but they're moments. And they're moments that we hang on to that we're like, this is joy. And
Yeah.
we still have to be very intentional about it. And so I think that's the key is knowing that we have to be intentional and knowing that we have to change that list based on, physical ability and enjoyment. And sometimes we need different things than what we needed 3 years ago.
Two more questions. I think that because it's so interesting because you are a doctor also and having to navigate this. And if you could speak directly to healthcare providers or hospice teams, well, hospice teams are doing great, but the healthcare
Yes, they are.
providers, what would you want them to know about what families need?
This is something I think about often. I will say, and I do some teaching with pediatric residents, and I do lecture to residents, and my lectures and my teaching really incorporate this life experience. And it's truly all the things that I wish I would have known. And so, in the things that I wish I would have known, that I would also want our healthcare providers to know is one, it is okay to ask somebody how they're doing and have a long, awkward pause and wait for your families to truly tell you how they're doing. I feel like our how are yas are quick and quickly shifting to the next topic of business and aren't really truly meant to have pauses for actual sharing. I know why I didn't used to do that. We're on a time crunch. I got to get on to see the next patient. I got to keep it moving. And I don't know what to do if you start crying. So I want to just put out there that asking and creating pause and not having an answer is okay. I can count on my hands how many physicians have asked me that with Soraya's 15 subspecialists, and they're some of my favorite doctors. My favorite doctors are ones that don't give me answers, are actually ones that just sit with me in it. And so I want to give permission for providers to know that that is okay. And that is really what families want is to feel heard. So that would be my first. And then the second is, really looking at big picture. I think that it's so challenging when we have all these subspecialists kind of doing what they do best. But I think every now and then it'd be wonderful for a non hospice provider to take a step back and to take a moment to look at the big picture of how's the whole family doing? How are you functioning with this big picture? And I don't think that we have that built into the medical system in office visits to be able to do that. And then lastly, communication. I think it's a huge issue in our families that have complex patients, both children and adult, where physicians aren't communicating with each other. And so many times you're focused on one aspect of the body, but you have no idea that the child is in hospice because your point of view, everything is going well. And you had no idea. So it's like one of those things where can we all talk to each other so we look through can still look through your lens, but acknowledge that there are other lenses and there's other perspectives and there's other things happening. So that is really what I wish for my medical colleagues to know. And I'm happy to share and help teach because this isn't a shame factor. This is we don't know what needs to be fixed until somebody has walked this walk and actually feels comfortable speaking about it. And I in no shape or form am saying that anybody that goes through this has to be vocal about it. That's not for everybody either. I think that this is such a unique journey. And again, my hopes for sharing is to help others.
As a doctor, and I know your husband is a doctor also, how has this changed how you practice, how you support families and people?
So, Tracy, the way I practice has everything to do with being Soraya's mother. I think, and I may get emotional as I talk about this because I don't think I realized that until maybe later on. I think initially in going through this journey with Soraya, I kept things very separate and compartmentalized. And I think somewhere in our medical training that has been, really pushed, whether it's subconsciously or direct. Like you are there to be there for your patients, whatever is going on at home, you keep it separate. You follow what we've been teaching you, and there is some protection. So while we have not been taught to like hold space, there is also like this unspoken like hold yourself back a little. Don't get too emotional because you don't want to get too emotionally tied. You want boundaries, you want, all of these things. And I think that that was really challenging in the beginning. What I ended up doing, again, kind of not planned, is when I would be in my family's rooms, even though they didn't know what was going on with Soraya, they didn't know that I had a child or like honestly, like leading this like secret life of being a parent with a child with medical complexity. I would do little things. So these little things were actually picked up by my residents that were working with me that they hadn't seen other providers do. So the first is, say you have a family that has a child with medical complexity and you see the families rushing in, they made it to their appointment. The first thing I'll oftentimes say is, can I sit in the room so you can use the restroom or you can get a drink of water or get a snack? And the families are always so grateful. Like I just like know what it's like to make to try to like get all the gear, get everything that you need to make it, and you can't be late for the appointment. That like many times I have to use the restroom and I'm like just holding it and I'm like, well, I have my kid, I can't leave them unattended. And so that's usually the first
Mm.
thing that I do. The other thing that I do, and I do this with all families, because I have this universal understanding that we all feel at times that we don't have things together, and we all feel this societal pressure that as parents we have to be perfect. Because if I feel that way, I am sure that others feel that way. And so it's almost like my own social experiment where I'll check in and say it's a new mom. I oftentimes will expose the challenges and I'll say, when I first had my baby, like I don't think I got dressed for 6 weeks. Like, no, what you see on social media is not real. Know that there are more than one way to feed your baby. Know that it's okay that you're exhausted. So I almost like give these like mini sermons of normalizing how hard parenthood can be and how what's on social media is not all real. And then the other part is I check in with families, all families, on what they're doing to take care of themselves. And so that
Mm.
might be like, do you go on a date with your partner? Who is there to watch your kid when you go on a date? Do you have like a trip coming up? And so they seem like very like random questions, but they're very intentional because I'll say, have you had time to work out? Or if I see that they're depressed, I'm like, what's holding you back from seeing a therapist? And so that's not necessarily something that I need to check off on every chart, but it's something that I like to do to check in. And, the joke around my office is I am the doctor that makes everyone cry. And while that is true, it is because I do that awkward thing. I check in and I say, "How are you? How is everything going?" And in that space, you learn so much about a family that this is where I differ. And this is where I'm completely different than the physician I came out of med school with. And some like fun things that I think are like kind of amazing is when you've gone through navigating the system, like sometimes my patients catch wind. Like they may not know the whole story, but they'll know that, oh, I heard Dr. Faruqui has a child with special needs. Then they start coming to you and they'll say, who's the best OT and who's the best PT? So, as you know, the joke is patients don't come to me for like my medical skill. They come from my life experience. And so that's like another fun thing where I'm like, okay, this is who I would go to for this. This is who I would go to for that. But these are like just little nuances that I practice differently. The other thing in a system where we're on a timer, we are have X amount of time to see patients. I will just come out and say that my work, I'm an employee, and my salary is based on what we call RVUs, which is how many patients you see per day. That I have decided. that I'm going to take as long as I need. So I actually go through each patient's charts, a couple days before, if not, and there's some that I know that will take longer, and I block out time so that way I'm not in a rush, knowing that I'm taking a financial hit. And I also understand that not everybody has the luxury of being able to do that. Like some people like can't do that and they have to see more to make more. But I refuse. And there are times where I just go over, and then most of my families know me by now that I'll say, if you ever need that amount of time, I will also run over in order to give you that time. Certain people need different things. You never know what's going to happen. They could be coming in for a sore throat, but you have no idea if they went through something traumatic and they want to share. So that's another way that I have kind of changed the way I've practiced. My husband, well, I can't speak for him. I can share the things that he has told me. And I think this is almost more telling as an adult surgeon. Surgeons in general have their own stereotype, and I will happily say that my husband kind of meets those, kind of quick to the point, in and out of the room, very like straightforward and wants to fix things. He will completely melt if anybody talks about grief or loss. Done. He has cried with patients. He has sat with them. He's got no template. He has no other colleagues that are doing this, so he just does what he does, and it's interesting to me in the sense of how open and able he is to share about Soraya with his families, whereas myself, I will ask a lot of questions. I will let them share, but I don't share. I don't know exactly like, I mean, I know where that's coming from, but it's interesting in that we do that differently. I think there's a internal struggle that I have, and I don't know if other physicians feel that way, but for me, it's tricky being a pediatrician and having a child that has a life-limited disease because my inner critic is worried that my patients might feel like, how can this doctor care for my child if they can't even keep their own kid alive? And I don't know where
Yeah.
that comes from, but that has taken some years of therapy to like realize that that's what's kind of holding me back from sharing. I also want to be very respectful for my patients who are paying me for this to be their space. So, unless they're inquiring and want to know, I try to keep it separate for their benefit. And I think this has been its own experience in that I'm so public now, and this is new. I come across as somebody who's always willing to talk about my experience, but this is all new to me. And that has been like a whirlwind in letting my patients in. So many have been with me for 10 years and have not known that I have been going through this. And I'm still getting messages, as of yesterday, like, Dr. Faruqui, I had no idea. And so it's been a journey. Been a
Thank
journey.
you for that honesty, especially because I was going to ask you, how do you navigate the system? Because you guys are on a timer, which is, you know, this is, I know that when I was a child, there wasn't a timer. It was not like, I remember spending a half an hour, 45 minutes with my doctor, easy. Um, and unfortunately now we don't have that. I have to say that I've been very fortunate that my doctors, maybe it's because I'm kind of demanding, but this is my health. I'm going to be demanding.
You're an advocate. You're not
Yes.
demanding. You're an advocate
Thank
for your
you.
health.
Thank you very
Yes.
much.
Yes.
I am my own best advocate because
That's
if no
right.
one is going to advocate, like I'll advocate for myself, um,
Exactly.
and for my husband too. Um, but I find it's really too bad because I know doctors do not, this is not a physician's choice. Doctors go into this to help people. And I know that the majority of physicians are like you, want to spend more time. And unfortunately, it's a systemic problem. It really, really is. And it's disappointing. No other, first world country goes through this. It's disappointing, unfortunately.
I completely agree. I actually truly have the best intentions in thinking that all of us have the best intentions in going into medicine. there is something that gets beaten out of you in the process. I feel like we as physicians have all entered this role to actually really be there for patients. I mean, it's what's in our personal essay, it's what's in our interview. They're not asking us about, organic chemistry equations or how fast can you talk. The system has changed us. The system has taken this out of it. And so many times I'll tell my residents, like, just remember your why, because you're always going to be asked to do more and see more. But what's your why that you even started? And how, when you hear about physician burnout, right? That's like a real thing. It really has to do with all of these demands. And so, like, what I do is I could be burnt out from all of these things. And many people are like, oh, I don't even understand how you're working and doing this. And it's like you can actually find joy in your job, just like you can find joy while your child is in hospice. And so, like, what are the things that I love about my job? It's the connection. So I have to like make an effort to do that. I can't wait for the system to change to allow me more time. I just have to create that change and take the hit. What's more important? If I did it the way that I'm supposed to do it, I would be burnt out and I wouldn't be able to practice. And so I think those things are really important in anybody who is training to be a physician, that there are joyful jobs out there. There is such a privilege and a joy to be able to care for families in this way. But unfortunately, you have to create your own curriculum and your path in order to get that until there is a systemic change. And you have to somehow hang on to that and not let it get beat out of you, for lack of a better word.
Yeah. Yeah. So we talked about before how access to pediatric hospice is very, very limited. From your perspective, what are some of the barriers that families are facing, and what would need to change to make this care more available?
So I think one of the biggest barriers is the conversation. I say the conversation as if it's just one, but really the conversation of when a child is declining. I think there are, I think there's barriers in the providers unable to either to say it or to share it, or the pressure that physicians feel to fix things or not to have an answer. I think that is a barrier within a provider. And then also, if there are no resources, it may be hard to talk about hospice, say if your area doesn't have a hospice. So, what does that look like? But I think for the benefit for the family, they need to know that that's where they would land if you did have a hospice, because there are other resources that can be helpful. But we don't know that until you know that you're at that juncture or that it could be helpful. And so there are, complex care type of pediatricians that may have a special interest in doing this work. Like if you're in an area where you can't have an hospice, like, can your primary care be that person? And what would that primary care physician need to be able to do? There are, networks and organizations that can help physicians have conversations, have the network, and have the resources, but it would take that pediatrician to have the initiative to do that. So I think one is like just limited resources in the sense of not every city, not every small town has a pediatric hospice. Two, barriers of education from our general practitioners. I think all general practitioners, adults and peds, need to have some ability to know where to go, some ability to know how to have the conversations and who can we call on. Three, there are pediatric hospice homes. News to me. So apparently there are, multiple throughout the country, that if
Mm.
I am practicing and I didn't have a hospice in my town, I know that I could email or I could pick up the phone and I could call them and say, can you help me? And kind of being willing to ask. So I think those again are limitations on barriers, and then also ways to kind of help that. The other barrier is, I think, language. And I mean this in both regards. I think sometimes when physicians are talking to families, they may feel like they're being very clear that there is no other option. But I don't know if the family's actually hearing what the physician is saying. So I think many times there's a disconnect where a physician is trying to tell a family, look, there's no more hope, but that may not register with the family that that means I am a candidate or could go into hospice. And it might be that the provider is waiting for the family to say something. There has been so much
Mm.
back and forth on the way to do this. Some physicians feel like they don't want to push a family to it, or when they do, the family just shuts them down because they are not ready to hear it. So that is a barrier, and they're uncertain on how to have that conversation. And for this family, they may have heard that there's no other options, but they didn't actually understand it that way. And they're like, oh, like there's still something else we can do, surely. And so they're waiting for the next big thing, but they don't know. So I think communication is a huge barrier, and how families perceive or understand information. And then there is the physician could be doing everything and offering, like, we can do hospice, we can do this, but the family is just not ready. And not only are they not ready, but they're angry. Like, to even say the word just brings up so much anger. And I think that's really, stemmed from a lot of myths of what they do. And so, like, how can you share with a family what they can do if they're not in a place to hear it? And how often do you go back and circle around? Then there are the families that welcome in hospice, but they say, on my condition, don't use the death word. So then it's like, you're allowing them, but are you really allowing them to do what they typically do if you're creating like barriers into what they typically do? So I think there's a lot of barriers,
Yeah.
but I think it's very multifaceted.
Now I'm going to switch gears right now, and I want to talk about your book, Keep Your Head Up. And it's coming out soon, which is such a gift. I can't wait to read it. So I'm really excited. What do you hope it gives people who are walking through a similar situation?
Thank you for bringing up the book. It's been a project that I've poured my heart into over the past several years. What I hope with the book is, one, for parents to not feel alone in the journey of having a child that is just different than what you expect. Doesn't have to be life limiting, but just different. The journey different, their health different, whatever that may look like. I hope that it helps healthcare providers know what they can do to truly connect with the family, and also this little lens, as I bring up, of what it's like to actually go to multiple appointments and go through this process and go through multiple periods of acceptance and denial
Mm.
and rage and back to acceptance. And I also hope that it will help those that have a life limiting disease, whether it's an adult or a child, learn how they can live with the grief and still live. That hospice doesn't mean everything's over and you just turn inward, that there's just so much more that we can do with our life if we turn outward. Overall, I really feel like this book has the ability to impact anyone that's ever had a plan and it just hasn't worked out the way that they had thought. There's some really big universal themes. The biggest purpose is to help eliminate isolation from this journey.
Mm. And the last question for someone who's listening, who might be parenting an ill child or feeling the early stages of loss, what would you want them to hear right now?
Think for the families that are going through experiencing impending loss or loss, I think the biggest thing is you're not alone. And I know that sounds so cliche, but I can say that when you're in the case of the quote unquote rare, you just don't ever think it's going to happen to you. You really don't. And even being a physician, I never thought this would happen to me. And that in those moments of despair and sadness and grief, you truly do feel like the rest of the world is experiencing all this joy and I'm the only one. And so it's not to out grief, but I'm going to out grief that many people are grieving and that they're not alone. And they don't necessarily have to be vocal, but they can look for resources. And so I have started an Instagram community for loss. find me,
Mm.
the Faruqui Five. This is what it's here for. Let's create community. It's okay for strangers. We can unite in grief. So the biggest thing is you're not alone. And then the other thing is you'll never get over it. And so I say that because I really think that society and the world is waiting for everyone to just get over it and move on. And there's nothing more infuriating, whether Soraya continues to live a very long life. I will never get over the grief of the life that I thought that she would have. That never gets easier. I love her. I love who she is. I love everything about her, but I'm still grieving. I'm still grieving what I thought she would be because I had created this subconsciously. But there's still a part of me that grieves that. And so I am just going to tell that family to welcome the grief, that you can carry that grief with you. You'll get used to it. You'll get used to its presence, but that doesn't mean that it doesn't hurt or you won't feel the sadness. And that I welcome still talking about it 20 years from now, 30 years from now, and that there's no pressure to get over it, that we can still feel that and feel happiness for the child that's in front of you, for the life that you still have. Um, so, yeah, I think those would be the biggest things.
Thank you. Thank you. Thank you so much for being on the show today, Tasha, and for sharing your story and your knowledge with such honesty. I really appreciate it. Before we close, how can listeners learn more about you and your work and your upcoming book?
Yes, thank you so much. For listeners that want to follow my own personal family journey, the Instagram account, the Faruqui Five, has all of it. All of, the details, all of the things that, I may have been too afraid to share in the past. It has everything on there. It also includes how the siblings are doing and how each of us are doing. It also has book updates on there as well. For those of you who are not as social media savvy, and I will say that my first Instagram account started when I started this journey, so I'm actually new to it as well. So there's no shame if you're not on Instagram. TashaFaruqui.com is my website, and there it has blogs on what our family is up to, and it has everything on the book tour. My publishing date is September 16th. The book sales are open for pre-order. Pre-orders help the book significantly in its success. And as much as I am talking about the book, I want everybody to know that I wrote the book for a legacy for Soraya, and know that all proceeds are actually going to children's organizations that are near and dear to me. So this book is for profit, but not for me. And so I think that's really important as you share and consider looking into this book.
Yeah. And pre-sales, I love that you mentioned that pre-sales are important. Most people don't know that if you get a certain amount of pre-sales, that the publishing companies actually support that book more, um, if and put more money towards getting that book out there and letting people know about it. So it's really, the pre-sales are really, really important. So I will put a link to the publisher, and I'm sure the publisher has all the links to like Amazon and Barnes and Noble and all that kind of stuff. So um, yeah, so it's important, if you are curious, even if you're just curious, just purchase the book. And then when she does her tour, when Tasha does her tour, go over and have her sign it. Uh,
Yes, I would
so
love to meet you.
so wonderful. And everyone, listeners, I hope that this conversation reminds you that presence doesn't have to be perfect. It just has to be real, whether you're facing uncertainty, grief, or simply trying to honor joy and sorrow at the same time. You're not in it alone. Even the most fragile moments, there is meaning when we allow ourselves to stay connected to each other and to the time we still have. Thank you for joining us. If you have any questions, please comment below or reach out to me directly. And if you found this conversation to be helpful, please like, share, comment, and subscribe. This is Tracy Ariely from Comforting Closure, wishing you peace and comfort in your journey. Until next time, take care.